Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for gonorrhea. The clap. What is gonorrhea? Gonorrhea is a dreadful sexually transmitted disease, STD, that arises from infection of Gonococcus bacteria. Infection can spread through oral, anal and vaginal coition. Unless treatment of this disease is initiated immediately after attracting the infection, stupendous complexity may arise. For example, infected man or woman can be completely sterile for the rest of his life. Further, different types of complex chronic diseases may endanger or destroy the quality of future life permanently. On the right hand side, images of Gonococcus. First one is electronic microscope, then microscope, finally the pass under microscope has been demonstrated. How does the clap spread? During sexual intercourse, a healthy person catches the infection if his or her partner is a patient of the clap. This does not spread from articles like pens, keys, phones, mouse, keyboard, towel, pillows, bed cover, etc. Personal body contact is enough for infection. Discharge of semen is not a must. At the time of delivery, if mother is infected, baby is also born infected. What are the symptoms of the clap? After catching infection, the following signs symptoms appear in 2 to 14 days. Number 1. In case of oral sex, pain and thrush in throat. Picture 1. Inflammation of the throat, fever, lymph gland of the neck swell up and become sore. This neck glands inflamed. In case of anal sex, bleeding, discharge from anus, itching, pain during stool, soreness of anus. In case of vaginal sex, whitish or yellowish or greenish viscid discharge, glit from penis or vagina. This is the glit of vagina. This is the glit of the penis. Number 4, burning, stitching in urethra, orchitis. Orchitis is inflammation of the testicle. Balanoposthitis. This is inflammation of the head of the penis and the skin which generally covers the head. That is called prepuce. Inflammation of prepuce and inflammation of the glans penis is called balanoposthitis. In male, difficulty in, but mind it, prepuce in case of female, also prepuce has got some meaning. Prepuce in case of female, it is the fold of skin which covers the clitoris. In case of male, it is the skin covering the head of the penis, prepuce. Difficulty in coition, bleeding in intermenstrual period, abdominal pain in female, and buboes. Buboes picture is not here. Bubo means inflammation of lymph gland, particularly of in the groin area. What are the symptoms of the clap? Number 4, continuation. Bacterial infection of one or more bony joints may create septic arthritis leading to joints. Septic arthritis leading to joints. Swollen, red, hot, too painful joints and sore. Actually, this is the picture of septic arthritis. Number 5, another prominent sign is conjunctivitis in the eyes. Severe conjunctivitis of the eye. How is the clap diagnosed or confirmed? Number 1, urine test. Number 2, throat swab test, anus swab test, cervix swab test. Picture 1. Penis swab test, urethra swab test, conjunctiva swab test. Picture 2. What complication may arise from the clap? For women, pelvic inflammatory diseases. Number 2, chronic pelvic pains. Number 3, sterility. Number 4, ectopic pregnancy. Ectopic pregnancy means the pregnancy doesn't occur in the womb, rather it occurs elsewhere, say in the fallopian tube, like this. Preterm labor, stillbirth, and HIV infection. This is actually stillbirth. What complications may arise from the CLAP? Continuation. For men, epididymitis. Number 2, impotency. For all, untreated CLAP may create following signs and symptoms through disseminated gonococcal infection. Number 1, nagging dermatitis. Number 2, fever. Number 3, arthritis. Number 4, tendonitis and swelling. When to consult a doctor? As soon as one comes to know that one has attracted the CLAP, one must consult a doctor, for the disease has enormous ability to lower the quality of life of the affected one as time passed by without proper care. This was proved by Dr. Samuel Hahnemann, the inventor of homeopathic system of medicine, about 200 years ago. The microbe causing this disease shall thrust upon the infected person the so-called chronic psychotic miasmatic state, if the same is not tackled properly in time. This means the progeny of the affected person would bear the stigmata too. Mind this, the progeny of the affected person would bear the stigmata, means that the remnant of the infection of CLAP. Please consult a Hahnemannian homeopath positively. This is very, very important. Very, very important. Please remember. How to prevent the CLAP? Number 1, if you think that there is a possibility of infection, strictly avoid sexual act. Number 2, keep relation with definite reliable partners. Mind that as the number of sex partner increases, the probability of getting the probability of getting infected increases, even if they are reliable. Number 3, using condom or dental dam lessen the possibility of infection. Who are predisposed to the CLAP? Number 1, women below 25 years of age. Number 2, who are habituated to anal sex. Number 3, who have more than one sex partner. Number 4, whose sex partner is infected with the CLAP. Now the remedies. Calcarea phos or Calcarea phosphoricum for the CLAP. Chronic gonorrhea with anemia or hydrocele, discharge viscid transparent like egg albumin, urge to urinate always, sticking pains and burning in urethra and at the neck of the urinary bladder, burning before, during, after urination, aching pain in waist and loin areas, subjects peevish, restless, fretful, forgetful, always want to go outside. That under the name of the remedy, when some symptom is underlined, please mind that is general symptom. That is the symptom of the person as a whole. Others are symptoms of the disease. Netamir for the CLAP. Chronic gonorrhea, glit, discharge of yellow pus or clear pus, that is, cutting pains in the urethra after urination, Blenorrhea urethrae, some sort of inflammation urethral at the orifice of urethra, urine deposit, big dust sediment, aching in testicles, subjects cannot tolerate who offend them, cannot tolerate fuzz, consolation, weeps bitterly without cause, sad, reserved, absent-minded. The picture of glit has been demonstrated here also. Silicea for the CLAP. Gonorrhea with thick fetid pus, especially after exertion. constant feeling of chilliness even during exercise, scrofullosis. This is a pure homeopathic term, scrofullosis. Cases of long-standing with slight steady discharge. Subjects lack vital heat, always chilled, no amount of dress seems sufficient. Worse from alcohol, bathing, moon changes, better in warm dress, summer with humid weather after passing profuse urine. Thuja occidentalis for the clap. Discharge thin, greenish with scalding pain during urination. Then sensation as if a drop remained behind. Violent urging but pass only a few drops of bloody urine. If failed to pass, intense itching in the urethra. Drawing, burning, cutting pain in urethra while walking, stitches in the urethra when not urinating. Urinal stream forked, checked, clapped causes prostatitis, articular rheumatism, impotence, paralytic weakness of extremities and mental depression. Subjects suffer from fixed ideas as if body made of glass, as if a living thing inside body, weep and tremble listening to music, fear green stripes. Cannabis indica for the clap. Severe urge to urinate with much strain but cannot pass a drop. Has to wait some time before the urine flows. Cordy. Well-marked priapism, nymphomania. Priapism actually excessive sex feeling. Nymphomania is the same thing in case of ladies. Subject worse in darkness, lying down from coffee, liquor, tobacco. Suffer from hallucination. Little distance seems immense. Time seems too long. Loquacious, forgetful. Cannabis sativa for the clap. Patient walk very slowly with legs wide apart. Troubles worse during motion. Smarting, burning during and after micturition. Constant urging with difficult urination. Dark redness of glands and prepuce. Sleepy during day. Sleepless at night. Sleepy during day. Sleepless. No sleep, that is, at night. In women, cutting during micturition between labia, violent sexual organismus, that is violent sexual urge, with swelling of labia. Meridionum for the clap. Burning in meatus during urination. Med is actually opening of the urethra. Frequent call, feeling of soreness in urethra and after urination feeling as if something remained in the urethra. Copious yellow purulent discharge in the morning and gumming up of orifice. Subjects want fanning all the time. Feel better lying on abdomen, fresh air, damp weather, seaside, stretching out. Worse in cold, daytime before storms. Acid nitric and for the clap. Gonorrhea with chancres and warts. Small blisters on orifice of urethra and inner surface of prepuce. Smarting and burning during micturition. Discharge sometimes bloody. Fine stitches through glands. Herpes like eruptions and condylomata about genitals and anus. Horrible pain. Much swelling and tenderness in testicles. Subjects irritable, vindictive, hateful, quarrelsome, tremble while in anger, feel better in a carriage. Sulfur for the clap. Phimosis, prepuce inflamed and indurated. Discharge is thick and purulent or thin and watery with burning, smarting during urine with bright redness of the lips of the meatus, stitches and cutting during stool. Now, just a picture. Phimosis. Phimosis is when the foreskin cannot be retracted back beyond the head of the penis. It's called phimosis. The skin lying here, it is inflamed. The reverse is paraphimosis. When the skin is back, it cannot be drawn forward. That is paraphimosis. This is normal, and this is the lip of the meatus, the opening of the urethral passage. Cordy well marked. Cordy, actually a bent penis is called cordy. Priapism, nymphomania. Priapism is male sexual overexcitation, and nymphomania is same for the women. Subject stoop-shouldered, averse to being washed, worse after bath, very selfish, no regard for others, worse from consolation and worse in bed, worse from standing, better from walking in open air and sweating. Sepia for the clap. Patient walk very slowly with legs wide apart. Troubles worse during motion, smarting and burning during and after micturations. Constant urging with difficult urination, dark redness of glands and penis. Sleepy during day, sleeplessness at night. In women, cutting during micturation between labia, violent sexual orgasms with the swelling of labia. Subject so chilly, feel cold in a warm room. Anxious over trifles, averse to family, to those love best, to sympathy, to company, yet dread to be alone. Sad, irritable, alternating with indifference or sulkiness.